Well, I was born in El Paso, but grew up actually near La Union.
Oh, okay. A suburb of Long Island.
Yeah, really a suburb of La Union. It was called Beverly Hills.
Oh, yeah.
Because of all the sand dunes.
Good morning, everybody. It's 9 a.m. on August 9th, 2022. This morning, our invocation will be given by Father Richard Cantonek from Holy Cross Catholic Church. Father Richard, thank you for coming in.
You're welcome. Please bow your heads if you're able. All loving and powerful God, by your wisdom and justice, your authority is rightly administered. Laws are enacted, and judgment is decreed. Assist with your spirit of counsel and fortitude these commissioners of our Doñana County. May they always seek the ways of righteousness, justice, and mercy, and grant that they may be enabled by your powerful protection to lead us with honesty and integrity. We ask this through you, Almighty God, who lives and reigns forever and ever. Amen.
Thank you, Father. If y'all would join me in the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Randy, will you call the roll, please?
Commissioner Ellens?
Here.
Commissioner Reynolds?
Here.
Commissioner Chaparro? Vice Chair Murillo?
Present.
Chair Sanchez?
Present. The commission convenes as the Board of County Commissioners and the County Board of Finance in open session. Mr. Macias, are there any changes to the agenda?
Mr. Chairman, there are no changes to the agenda.
All right, then we'll move on to Pet Showcase.
Mr. Chair?
Commissioner Reynolds?
Yes, for changes to the agenda, is it possible to move the staff input, county elected officials input, and commission input to the earlier in the meeting?
Perhaps that is a question to be addressed to the chair.
I'm sorry?
That is a question to be addressed to the chair. We have no changes to the agenda.
I mean, I don't mind, so you said staff input, county elected, and commission input?
Yes, I'd like to move those to the front, earlier in the agenda.
Okay. So we can move,
After employee recognition.
okay, so we can move, if there are no objections from the commission, we'll move staff input, county elected, and commission input to after employee recognition. All right, then we'll make that change. Okay, then we'll move on to Pet Showcase. Commissioner Macias?
Thank you, Mr. Chairman. For those of you in the audience who may not be aware, the County Commission takes advantage of every meeting to be able to advocate for the adoption of animals from the Animal Service Center of the Mesilla Valley. Our cat of the week is Apple. You might recognize me as the cat of the week from a few weeks ago. Can you believe I still haven't been adopted yet? I'm as sweet as can be, And now I've moved into the public adoptable cat room where anyone can come in and hang out with me. The sweet people at the Animal Services Center of the Mesilla Valley are sure that I can find my forever home this week, so stop by and fall in love with me. This is Apple, who's 2 years old and a domestic short hair. Our dog of the week is Spots. I have an almost Rorschach type of look to my spots, so look at my face and tell me what you see. It is me being your next forever friend. I'm calm and gentle and great on the leash. I'll sit on command too. I'm overall such a good boy. I'm not sure why I'm not in my forever home yet. I hope this week is my week and someone gets to meet me and can't help but want to take me home. Spots is 3.5 years old, a medium-sized dog, and male gender. So there's some also other opportunities to adopt either of these animals or some other animal that you may desire to adopt. There is an Adopt a Co-Pilot Day at the War Eagle Air Museum, and that's down in Santa Teresa. And then there's a Clear the Shelters event that is going on all month long. Adoptions are only $25, and the first 170 adoptions are fully sponsored by Borman Autoplex. And that applies to the cats as well. And the Air Museum, the War Eagles Air Museum event is this Saturday, the 13th of August from 10 a.m. to 2 p.m. So again, on behalf of the Commission, we encourage the public to consider adopting a wonderful dog or cat from the Animal Services Center of the Mesilla Valley. Thank you, Mr. Chairman.
Thank you, Mr. Macias. And we'll move on to employee recognition.
Thank you. So if there's anyone here in the audience who isn't aware, the County Commission takes advantage at every meeting to be able to recognize employees who have met a certain threshold in their time with the county. And we have a very special employee to recognize this morning who has been with the county for 20 years. And that's Mariah Carnero. Mariah, come up, please. Mariah joined Doñana County on the 26th of August of 2002 as a temporary employee in the utility department, although because she came with quite a bit of extensive experience, she assumed many responsibilities right away. Mariah is certified as a utility operator by the New Mexico Environment Department with the highest certification of level 4 in water and wastewater. She received the New Mexico Water and Wastewater Association's Carolyn Martinez Award for Outstanding Achievement in 2018 for working for more than 2 straight days on the major emergency in Vado and Berino because of manhole collapses that had occurred. She's earned a promotion to wastewater operator senior in July of 2003, then to water wastewater operator 3, and later operator 4. In 2008, she became a lead operator, and 2012, she was promoted to assistant manager of utility operations. Everyone highlights her ability to work well under pressure and responding appropriately to emergencies at all hours of the day or night. Mariah provides customers with excellent service, managing obstacles along the way and prioritizing solving problems, big and small, whether they seem or not yet or apparent. apparent. Her supervisor, Eric Navarrete, said Mariah is highly valued because she treats people with respect and is dedicated to her work. She consistently goes above and beyond the call of duty and deserves recognition and accolades, but does not seek the limelight. On any given day, Mariah manages a crew of 8 operators, and together they keep Doña County's wastewater systems in compliance with state and federal regulations. She said she takes special pride in her small crew's ability to work well together as they manage stressful emergency situations as a team and to get the job done well. When she retires, and hopefully that won't be too soon, she plans to continue to work in this area, but in private industry. So ladies and gentlemen, congratulations to Mariah on her 20th work anniversary, but will you please join the County Commission in giving a special recognition to a very special dedicated employee on behalf of the community, Mariah Carnero. I don't know, is that a fish hook that you have on your cap? Okay, a fish hook. Nobody told me about your interest in going and fishing. Am I saying it right? Oh, Mireya. No. Okay, so let me read it carefully then. Mariah Carnero. In appreciation for and recognition of 20 years of dedicated service to Doña County, on behalf of the Board of County Commissioners and County Management, from the 26th of August of 2002 through the 26th of August of 2022. Mariah Carnero. Thank you. So let's take a picture over here. Mr. Chairman, there are no other recognitions today.
Okay, so then we'll go ahead and have staff input. We'll have Mr. Stephen Lopez.
Good morning, Chair Sanchez and members of the commission. This is going to be our final Doña County Salutes recognition of our major COVID partners. And so with that, happy to present the video that is recognizing the contributions from the City of Las Cruces.
This week, Doña County salutes the City of Las Cruces for their efforts during the COVID-19 pandemic. The City of Las Cruces provided the convention center has a vaccination site along with volunteers and paid staff to assist in vaccinations. The first vaccination point of distribution at the convention center was held on January 14, 2021, and the last was held on July 22, 2021. Within that time frame, 37,595 doses of vaccine were administered at that site. This site was truly instrumental in reaching the community, particularly on days where rain and high winds prevented outdoor vaccinations. Doña County salutes the City of Las Cruces. Thank you for providing shelter that enabled us to magnify our COVID-19 efforts in the community.
Mr. Chair and members of the commission, again, City of Las Cruces really stepped up by providing us a facility for over 6 months at no charge that really helped us reach a significant portion of our population. And Before I take any questions from the commission, just do want to say that our hospital data continues to look very good. We're holding down in the single digits as far as hospital beds occupied by COVID-19 patients. And our wastewater surveillance that is coming from the 3 of the wastewater treatment plants operated by Doña County, the South Central Wastewater Treatment Plant, the Chaparral Wastewater Treatment Plant, and the Rincon Wastewater Treatment Plant, are all showing that we have a steady rate really over the last month. And our case data, testing data from the Department of Health over the last 2 weeks is showing pretty much the same pattern. So it's good to see that consistency in the data. And I'd be happy to take any questions from the commission.
Are there any questions for Mr. Lopez?
Mr. Chairman,
Commissioner Ellens?
how is the county doing on monkeypox?
Chair Sanchez and Commissioner Ellens, right now we have no cases of monkeypox in southern New Mexico to include Doña Ana County. There are 10 cases reported through Friday of monkeypox. They're in northern New Mexico, and they all appear to be travel acquired. So they were not acquired here in New Mexico. They were acquired outside of the state by residents on travel and brought back in. So we are doing quite well, though we are sharing information with our first responders and medical community on how they can recognize signs and symptoms and protect themselves should it reach us.
Thank you.
Thank you, Commissioner Ellens. Mr. Lopez, thank you so much.
Thank you very much.
And I appreciated this series of recognizing all of our partners that helped during our COVID-19 pandemic. So thank you, sir. Mr. Macias, is there any other staff input? Oh, Chief Cherry?
Good morning, Mr. Chairman, Commissioners. I'll give a minute for the short PowerPoint to be brought up. But I wanted to take the opportunity this morning to thank and inform the Commission on a couple of projects that we've done to improve services within the community. Well, looks like they're almost ready. It got here a little late, right around 9 o'clock this morning, but we actually do have one of the new fire trucks sitting outside. So any of the public or commissioners afterwards, if you'd like to stop by, look at it. And we also have some of the other new equipment outside for the public to view. And I don't know what they're doing. All right. So here's a couple of the pictures of the new fire trucks. They are in town. There's 3 of them that have been delivered. Graphics packages and other equipment have starting to been installed to help spread our recognition as we're in the community. Because when they arrived in Doña Ana, people saw them and they're like, "Why is there a bunch of blank white fire trucks running around?" And so we did this through a local vendor. Again, and at this time I would like to thank the local sales representatives that here in Las Cruces, Firefighter Trucks. They've been great to work with through this manufacturer and have been unbelievably supportive in getting these into the community as quickly as we have in today's industry. The commission approved these about 13 months ago. Any other vendor was quoting anywhere from 18 to 24-month delivery times, and these are here in Las Cruces, ones outside. So that's a huge achievement just to get them here to meet our needs. Looks like they already loaded a picture from outside onto my PowerPoint. So that's outside right now. The 3 more of these fire trucks we should see in the community by the end of next month. This is just a picture of what's going on at the factory right now. And I have several other pictures that we're going to share through social media that shows some of the progress that's being made on the additional 3 trucks. We've already had these trucks out in the community, getting them at National Night Out the other night. They actually will be at the State Fair. We're going to have one of these trucks next month out at the State Fair for the whole week. We have 2 other events, one at the Field of Dreams with a career day with Las Cruces Public Schools, and another event at Field of Dreams in the very near future where we're going to have these trucks out in the community, showing them that how we're improving our fire and emergency services. This is another improvement that's been made in the department over the last 18 months. We were blessed to receive, with the commission support, a $435,000 grant from the State Fire Protection Funds last year. Then it was all put towards extrication equipment. We chose to go with an all-electric system versus the traditional power plant hydraulics that, not only causes some hazards due to high-pressured hydraulic hoses. The electric system is much quicker and easier to deploy in an event of emergency. And so all of that equipment has been delivered. Training is going to commence in tandem with the training on the new fire trucks. And so that all should be deployed within the next month to the 9 stations that we were able to outfit with that grant. Another big improvement to the system was something that was supported through ARPA and the County Commission. We have received the 12 new advanced cardiac life support monitors and 19 of the mechanical CPR devices. And so those have been in the field since January after receiving, we did 12 rounds of training throughout the county with all of our staff and volunteers. Our partner in this, Zoll Medical, has been an amazing training partner in helping us get these instruments out, and as well as connecting with the hospitals and being able to transmit the data that we gather in the field to the hospital so that patients can receive care quicker. So those are 3 of the big projects that we've been working on over the last 18 months that are actually in deployment. So I just wanted to brief you on that if you have any other questions. I heard there might be a short video. No video? Oh, okay. So they ended up not loading the video. This is the screenshot of a video that we're going to start pushing out on social media that talks about the specifics of the cardiac equipment and how it's being deployed and the benefits to it. So we're not playing the video, but if there's any questions, I'd be happy to answer them.
Thank you, Chief Cherry. Are there any questions for the chief?
How many of these trucks did we get?
So there's 6 fire engines, like the one that you're looking at outside today. 3 of them are here. 3 of them will be here next month. There's actually 2 what we call pumper tenders. So they carry more water. They don't carry as much equipment as what we call a fire engine that will be delivered in September. So there's a total of 8.
Okay. And did we get any smaller vehicles?
Not as of yet. There is in the budget that you approved 3 brush trucks, what forestry refers to as type 6 apparatus that meets the state forestry and federal forestry specifications that we're working on right now. And we're working with a couple of vendors to put some quotes together, and that you should be seeing that shortly.
Okay. Are we going to auction off the old stuff or donate it?
So there are 6 fire engines that we are taking out of service. They're all 1994 Laverne's is a manufacturer that's no longer in business. I have been contacted by a few of the outlying areas within the state. They would like us to consider doing some asset transfers for them. Even if they can keep them in service for a year, it helps improve their rating enough that they can increase their funding, that they can maybe finance a newer engine. So they're hoping to get a year to 18 months out of them and help out some of those other communities. So that as that works out, that should be coming before you as well.
I think that should work because we've certainly used them past their expected life, so and kept them in good shape. So I think it's a great idea. Thank you.
Okay. Thank you, Commissioner Reynolds. Is there any other comments or questions for Chief Cherry? All right.
Thank you.
Thank you for the update, Chief. All right. Is there any other staff input, Mr. Macias?
No, sir.
Okay. We're on to county elected officials input. Sheriff Stewart. Good morning, Sheriff.
Good morning, Mr. Chair, Commissioners. It's great to follow positive news. This is more positive news. I want to take you back to March 1985. We all probably weren't here, but we were somewhere. So think back to that day. On that day in Doñana County, hunters found skeletal remains of what was soon identified as a young female under 20 years old. She was found about 20 miles north of Upham Road and about 10 or 15 miles east of I-25. To the present, as of about 30 days ago, 60 days ago. She was identified only as Jane Doe. With the incredible work of Detective Melissa Aguyo, with her assistance from the National Missing Child Organization, a company called Estrella Forensics, and innovative forensic investigations, this Jane Doe has been identified. She is from Wichita, Kansas, was from Wichita, Kansas, and it was a great honor for our department to be able to meet with her mother and her 5 siblings to tell them she's going to go home. Today at 2 o'clock, there will be a live press conference in our department as to this. It will feed on Facebook for the county live, and it will feed through the affiliates of ABC, NBC, and CBS in Wichita, Kansas, her hometown. We believe this will lead to hopefully identification of suspects in this case, but these are rare. Although you've seen more in the news since 2018, they're still fairly rare across the country. We are, as DASO, very, very pleased to be able to announce this to you today. So join us at 2 o'clock on some feed, and you'll hear the entire story. So thank you for this.
Thank you, Sheriff, and appreciate it. Thank you. Congratulations to your department, Detective Aguyo, and to the staff on the milestone. All right, any other elected official input? Dr. Askin? No? Okay. Commission input? Is there any input at this time?
Mr. Chair, if I may.
Madam Vice Chair?
Well, she already left, so I just wanted to express here. As elected officials, we are to be conducting business professionally. Also, have integrity, right? And we're supposed to set an example, especially when we have employees under your belt. And I have a question for our commissioners. Commissioner Reynolds, Commissioner Chair Sanchez, Commissioner Allens, and Commissioner Chaparro. Did we ever vote on bringing 12 officers for the sheriff? When was this? This is the question I have.
No, Madam Vice Chair, I think with what we're talking about, I think what was discussed is that I think that was part of an initial request. After further discussion, I think that was revised and brought to the commission as our preliminary budget in June. I believe you're talking about the quotes in the Las Cruces Sun News.
Yes. So last week, there was a community meeting at the Women's Intercultural Center, and I wasn't able to attend due to a funeral out of town. So I wasn't there. But I was thrown under the bus with my fellow commissioners. And I do express this concern because we are supposed to state the facts. As elected officials, we're supposed to do our research. I did my research this weekend because I saw in the newspaper that my name was dragged in the newspaper that to ask me questions about these 12 officers that were not given to the sheriff, right? First of all, the people that called me didn't call me to ask me out that. They called me to warn me because they said that what was said in the meeting was not right. And they said, Commissioner Murillo, you need to take this and do your research, what's going on. That was it. So I'm bringing it to our commissioners and to people that are hearing all this. At any time, I did my research, and as of August the 2nd of this year, there has been 19 vacancies with the Sheriff's Department. 19 vacancies. common practice in local government, county government, or even state government, you need to fill your positions first before asking for more officers. I state this because as a mayor in my other position, if the chief of police comes and asks me, I want 5 more officers, I usually tell them that you already filled the vacancies that we have first, right? Because it's in the budget. Now, we have 19 vacancies as of August 2nd that have not been filled, and supposedly was requested 12 more vacancies that I don't remember hearing about 12 vacancies. Now, with that being said, we have these 19 vacancies. I remember back then as being an elected official for the city of Anthony with the former sheriff. I knew that he had some vacancies available at that time, but he still was able to provide school resources officers at that time. And I don't see why we couldn't do it this time, right? I don't know what's going on, but this past fiscal year of 2022, 2021, 2022, the Sheriff's Department did not utilize $2.3 million of the approved budget, right? So this is all misinformation, making us, the commissioners, look bad, like that we're not doing our job. As common practice, like I stated, and you have money in your budget, you fill in your vacancies, and then you ask for your 12 officers. And I just don't think that's appropriate. Maybe she's confused. She asked another commission because I don't remember and I don't recall it was said on this, in any meeting. Also, as that meeting was stated, we have not had this relationship with the city of Anthony and the sheriff as it's supposed to be. There was misinformation also at that meeting saying that the Anthony Police Department had to be cross-commissioned and able to be resource officers. The officers have been cross-commissioned for quite some time, but the Sheriff's Department never even asked for those, even identified or even told the police department that the cross-commission cards were available until after the meeting when we already had been, the police department have already been blasted. I just see that it's not right, that, get your facts straight, and then you can say what you have to say, Also, DASO has gotten the biggest total budget this year than in the past 10 years. In 2013, there was $17,737.64 that they had in the budget. Going along the years, year 2021, $23,412,134. Year 22, $22,728,299. And this year, $25,197,623. $1,290,000 were allocated for DASO fleet. So they have all the resources. They have the money to be able to get those vacancies filled. So I'm just very, very disappointed that we were thrown out like this when we are doing our job as commissioners. And to take accountability on her department should be on her, not on us. So, thank you.
Thank you, Vice Chair Murillo. Is there any other commission?
Yes, good morning, Mr. Chairman.
Thank you, Commissioner Chaparro.
And as to dovetail after what Commissioner Murillo has said this morning, I do recall the meeting where the sheriff was here and asked for additional monies, but the only thing I recalled that was requested was $50,000 for a server. I don't recall having been requested for 12 additional officers, and Commissioner Murillo is correct. The sheriff does have $2.3 million that were unused in last year's budget. So at least for this commissioner, I do not recall a request from the sheriff or the sheriff's department for 12 additional officers. I also recall a meeting where I inquired about vacancies and was told that 10 vacancies or 10 positions were being held because new cadets were going to be graduating and they would be filling those positions. Thank you, Mr. Chair.
Thank you, Commissioner Chaparro. Is there any other commission input at this time?
Mr. Chair.
Commissioner Reynolds?
Yeah, thank you. I don't recall these discussions either. However, I do believe that this is something that's, this sounds like it's just important that we should actually schedule a time for the sheriff and human resources and the manager, Manager Macias, to actually discuss with us what the practice is for hiring people. Because it's my understanding that even though the positions are allocated, that some of the departments and some of the elected officials still have to have the human resources and county manager approve those hires. And I'd like to understand that process better so we are all educated to know how these things happen. So I think this is not the right forum to do that, and I'd like to suggest that we have a meeting and schedule a meeting to actually have this discussion with everyone. That's all. Thank you.
Thank you, Commissioner Reynolds. Mr. Macias, did you?
Mr. Chairman, forgive me. It's one thing to kind of say things, and suggest that the commission should know more information. This commission is as well informed as any commission in the entire state of New Mexico about what occurs. There are, as we speak right now, 44 total vacancies in the sheriff's department. 19 were where we were at the end of the fiscal year. It has nothing to do with human resources. Human resources has processed all of these applications on a very timely basis. Historically, over the course of the last 3 years, we have hovered at that approximately 19 vacancies, and that has nothing to do with cadets that will be stepping into positions. These are 19 positions above that. And the commission did approve 2 additional detectives, 3 evidence technicians, a unit for evidence, a mobile unit for evidence collections costing nearly $600,000. You don't keep adding positions when you cannot even fill the positions that you currently have.
Mr. Macias, the number that you had stated, the 44, is with the 5 additional heads, is that correct?
Yes, that's correct.
So even before those 5, it was 39 heads, which
Yes,
were about 20, which included 19 law enforcement and 20 administrative staff?
That's correct. And if you look at,
Could there not be, if there was a need for additional law enforcement officers, could some of the administrative staff be reclassified and approved by the commission if that was a request?
oh, absolutely, because there's at least 11 positions in the administrative area that have not been filled that are open.
Okay. Thank you. Appreciate it.
Mr. Chair.
Commissioner Reynolds?
Yeah, I still don't think this is actually the forum in order to have this discussion at this point. But I would like to ask Mr. Macias one more question. How many authorized positions do we have in the county currently? 900 and how many?
About 979,
And how many do we actually have that are filled?
780.
780. So how long have we been carrying roughly over 100 open positions in the county without filling them and still asking for additional positions?
I'd have to look at each individual department, but if I'm understanding your question, you're asking how long have those positions been open?
I guess my point is if I understand Commissioner Murillo correctly, and possibly Commissioner Chaparro correctly, that part of the problem here is that we are adding positions to a department without filling open positions. And it's my understanding that in the last 4 years, we've done that on a regular basis at the county for all departments.
No, that's not correct.
It's not. Okay.
There's certainly turnover, as you're well aware, in every department, but in every department that has received additional employees, of which there have been very few. The only ones that I can even think of outside of the sheriff's department were the 6 that we added into the clerk's office this year. Very few new positions have been added over the course of the last 3 to 4 years. I'm not saying that there haven't been challenges in filling certain specialized positions, but actually this year, because of the labor negotiations that have occurred, we are going to be able to hire people with greater levels of experience and be able to fill some of those special positions, those somewhat unique positions. But there's positions within some of the departments and that haven't been filled for years, haven't been able to be filled for years. But the suggestion that the commission has failed to do its responsibility is false. The commission has properly funded all departments with adequate numbers of personnel.
Okay. No, I agree with that. I think you're right. I think the commission has funded the positions that we believe are required in the county. And filling those is a responsibility of it's a responsibility of human resources first.
It's the responsibility of every department, especially in this hybrid system that we have with elected officials. They bear a burden to ensure that their positions are being filled. If there is some kind of issue, they have every opportunity to raise that kind of concern in terms of not being able to fill positions. But this commission has given the sheriff's office certainly incentive money, $6,000. Certainly the issue that we need more personnel, that might be very relevant, and perhaps the commission at mid-year can take a look to see if there's continued justification. But that nucleus of nearly 19 law enforcement officers' positions unfilled has existed over the last certainly 3 to 4 years.
Thank you, Mr. Macias. Mr. Chair, I would actually seriously, I still respectfully request that if we're going to have this discussion, we have some education by Human Resources, have the sheriff have an opportunity to speak, and other departments to participate as well.
Okay.
I think that's the only way for us to really better understand, or at least for me to better understand what we're talking about here, because I apologize that you were attacked by the paper. I don't think that was fair or right. Or the county being attacked by the paper without due diligence and an understanding of what's going on. But still, as a board, I think we owe it to our constituents to actually, if this is an important matter that we need to address, that we need to have all parties present in order to have a real discussion about it. But I appreciate everyone's opinion.
Thank you, Commissioner Reynolds.
Thank you, Mr.
I'll just add before we move on here, I can understand the frustration by Vice Chair Murillo and Commissioner Chaparro. And I think the main reason is I know I got several calls, and just a comment that was made to me was this from a constituent, that they trust what was coming, what they saw more from the sheriff than what was the commission. And I think the issue becomes where facts are not all put out there by the paper.
Exactly.
And so it becomes not a full discussion of the facts that are available. And I think that's where I get, like I said, I think there is a level of frustration out there that I think the commission has worked hard to support the sheriff and the rest of the county elected officials. And so when I think in this case, I think it was the Sun News, we also saw a story from KDBC or KFOX that only some of the information is put out there. I think this goes to your point, the public doesn't get all of the facts. And I think that gets a little frustrating from where we sit when we are criticized without all the facts being present. So I think that's, like I said, I understand your frustration, Commissioner Murillo, Vice Chair Murillo, and understand, like I said, Commissioner Reynolds, understand the importance of, like I said, I think getting all the facts out there. So thank you.
And Mr. Chair, before you move on from this subject, I'd also like to clarify to Commissioner Reynolds, I did not say that we were adding new positions without the commission voting on it. I never alluded to that. And you mentioned earlier that both Commissioner Murillo and myself had requested, or we were encouraging new positions be added without filling vacancies, and that is absolutely not true.
And I said, we'll have a discussion. Maybe we can have it on an agenda item.
Sorry, Commissioner Chaparro, I don't, if I said that, that's not what, that's what I intended. I think I just said that, I think I just simply said that I'm all need more education about what it is. I have no idea what happened with you guys, but I think it's sad that anybody on the commission is attacked for a position we take on funding personnel and organizations in the county. But thank you.
Thank you, Commissioner Reynolds. Thank you, Commissioner Chaparro. All right. Then we'll move on now to agenda item number 1, which is regular BOCC meeting minutes for July 26, 2022. I don't know if there's any amendments or changes to the meeting minutes.
Mr. Chairman,
Commissioner Allens?
why are we moving on to the rest of the agenda when we haven't had public comment yet?
We had originally moved all of our comment to the end so that way we could conduct our business.
Is that a permanent change?
I wouldn't say that's a permanent change. I think this was something that was done for this specific meeting.
Okay.
All right. If I can get a motion and a second to approve, or a motion and a second for the approval of the meeting minutes for July 22nd, 2022.
moved.
Second.
Moved by Commissioner Chaparro, seconded by Commissioner Reynolds. Is there any input on the meeting minutes? All right. Hearing none. If I can get a roll call, Brandy, on agenda item number 1.
Commissioner Ellens?
Yes.
Commissioner Reynolds?
Yes.
Commissioner Chaparro?
Yes.
Vice Chair Murillo?
Yes.
Chair Sanchez?
Yes. Okay, those meeting minutes are approved, 5-0. All right, we're on to our presentation proclamations. Agenda item number 2, which is proclaim August 7th through 13th, 2022 as National Health Center Week in Doña Ana County. If I can get a motion in a second to begin the discussion.
So moved.
Moved by Commissioner Chaparro, seconded by Commissioner Reynolds. Thank you for that. I wanted to take the time to recognize our community health centers that we have here in Doña Ana County, from Santa Teresa through Oregon and all the way to Garfield. Our residents who need it most can find health care and services from our federally qualified health centers, which are run by the Amador Health Clinic, Ben Archer Health Centers, and La Clínica de Familia. Ben Archer Health Center is recognized as a patient-centered medical home through the National Committee for Quality Assurance and certified through the Joint Commission. The Ben Archer staff consider themselves privileged to serve more than 50,000 underserved patients annually. They graciously attribute all of Ben Archer Health Center's continued success to their amazing, high-qualified staff and all of their supportive community partners. La Clínica de Familia has offered a broad range of services for 46 years and sees 33,000 patients annually in 30 facilities comprised of clinics, housing, maintenance, and administrative locations. La Clínica has 5 school-based health centers in Chaparral, Santa Teresa, Gadsden, and Centennial High Schools, along with the Rio Grande Preparatory Institute. The Amador Health Center, which was established in 1990, has over 200 visits per week here in the city of Las Cruces, which adds up to more than 5,000 visits per year, and is a critical part of the Mesilla Valley community of hope. We're grateful and we're lucky to have these partners that work with Doña Ana County and for our residents year-round, providing services. We're especially grateful for the services provided over the last couple of years during the COVID-19 pandemic with vaccinations, boosters, as well as continuing to serve the public even through these tough times. So thank you to your organizations for everything you do. Here this morning to accept the proclamation, we're honored to welcome Ms. Kara Bauer, who is representing the Ben Archer Health Center. Virgil Medina, the CEO of La Clínica de Familia. and Pamela Angel, who is the CEO of the Amador Health Clinic. Mr. Macias, if you wouldn't mind reading the proclamation, please.
Thank you, Mr. Chairman. Whereas for more than 50 years, community health centers have provided high-quality, affordable, comprehensive primary and preventative health care in our nation's underserved communities, delivering value to and having a significant impact on America's healthcare system. And whereas community health centers are the country's largest primary care network with more than 253,000 physicians, nurse practitioners, midwives, and clinical teams who provide health care to 30 million people in 14,000 communities across the nation. 1 in every 12 people in the United States receives care in a community health center. And whereas community health centers reduce overall cost of care by helping manage patients' chronic conditions, keeping them out of costlier healthcare settings like hospital emergency rooms. Whereas Doña Ana County's Health and Human Services Department funds and works collaboratively with federally qualified health centers run by Ben Archer Health Center, Clínica de la Familia, and Amador Health Centers. Together, the centers have provided comprehensive medical, dental, and behavioral health services to the underserved population. They also provide support such as transportation or enrollment in health coverage. And whereas throughout the pandemic, these centers provided COVID-19 testing, vaccines, and treatment. During National Health Center Week, we thank all community health center staff, members, and celebrate their vital role in shaping the past, present, and future of our community's healthcare system. Now, therefore, as the Doña Ana County Board of Commissioners does hereby proclaim in the second week of August as National Health Center Week. Mr. Chairman, a proclamation for the consideration of the board.
Thank you, Mr. Macias. And I'd like to invite you all, if you have any comments you'd like to add, you're more than welcome. Ms. Angel, Mr. Medina, Ms. Bauer.
Thank you, Mr. Chairman and commissioners and county staff, Mr. Macias. So we're the newest kid on the block, Amador Health Center. We were a free clinic called St. Luke's Healthcare Clinic since 1990. And in August of 2015, we received HRSA funding and became an FQHC to join our colleagues from Ben Archer and La Clinica. What makes us a little bit unique is that we're on the campus of Mesilla Valley Community of Hope, and we serve 50% of our patients. We serve our homeless. We also try to provide services to special populations. What was added in our strategic plan 3 years ago by the board of directors of Amador Health Center was to reach out to the LGBTQ community. And we're happy to say that we're able to provide hormone replacement therapy as well as other therapies to that community. We also have the Amador Recovery Program, and we provide substance abuse treatment, medication-assisted treatment for people with alcohol, methamphetamine, and opioid use disorder. And that's program's called Amador Recovery Program. So it's great to join our colleagues in this honor for Community Health Center Week. Thank you. If you have any questions, please let me know.
Thank you, Ms. Angel.
Mr. Chair, if I may,
Vice Chair Murillo.
where's Amador Health Center located at?
We're on 999 West Amador Avenue on the campus of Mesilla Valley Community of Hope, across the street from the Gospel Rescue Mission.
Okay, thank you.
Thank you.
Good morning, Chair Sanchez, members of the commission, County Manager Macias. I just really want to express my most sincere appreciation for the partnership that the county provides. We've had a long-standing relationship with the county. It's been very supportive and very beneficial to the communities that we serve. We provide uninsured care to those in need. We provide assistance to those that can't afford to pay for health care. One of the things that we continue to see as a rising concern within our communities is behavioral health. You know, we're starting to see right now in our particular organization, 48% of our business now is on the behavioral health side. And that's slowly catching up, and that shift is starting to turn where it was vastly medical and dental. Now it's really starting to rise, and behavioral health is a real concern. Workforce continues to be an issue, so I'm hoping that in the future there's some things that we can do together as a community to figure out ways to ensure that the care for our community remains intact. I can't speak for my colleagues, but I can only assure or assume, based on information and research that I've done, that they're experiencing some of the same things as it relates to workforce. It's a concern because if we can't continue to provide the clinicians necessary to treat our patients, then they go without. So I ask the commission and the county to continue to work together with us, and hopefully in the future we can continue to partner up with members of our community to figure out ways to be more efficient and effective as it relates to the services that we're providing our communities. So thank you all very much.
Thank you.
Good morning. On behalf of Ben Archer Health Center, I just want to say thank you for the recognition, and also thank you for our partnership with the county. We know that our partnership with the county has been invaluable in our ability to serve the community, and we look forward to more years of serving the community. Ben Archer Health Center has been serving the community for over 40 years, and the northern portion of the county as well as Las Cruces, and thank you.
Thank you, Ms. Bauer. Are there any questions, comments?
Mr. Chair.
Commissioner Reynolds?
Yeah, I just want to say that I think that the services that you provide in this community are unparalleled and certainly important to the health and well-being of everyone we serve, and we appreciate it. Thank you.
Thank you. Are there any other comments, public input? All right, Brandy, will you call the roll, please?
Commissioner Ellens?
Yes.
Commissioner Reynolds?
Yes.
Commissioner Chaparro?
Yes.
Vice Chair Murillo?
Yes.
Chair Sanchez?
Yes. That proclamation is approved, 5-0. Thank you. Thank you. I want them up if we want to take some pictures.
Commissioner Sanchez, did you want to join them down here?
Commissioner Ellens, could you get a little closer, please?
And let
Commissioner Ellens, could you scoot over to your left? Thank you.
Thank you.
All right, then we'll move on to agenda item number 3 now, which is the 988 Crisis Now System Update. Ms. Jamie Michael.
Good morning, Commissioners. Jamie Michael, County's Health and Human Services Department. Very pleased to be able to provide an update for you on, I think, one of the most impactful policies related to healthcare in recent years. So as you heard Virgil talk about, behavioral health has become an increased need and an increased source of or piece of the healthcare delivery system. And I know that Doña Ana County has been focused on this for over a decade, especially the part of the behavioral health system that is that crisis response or that crisis care. So today I'm going to talk a little bit about 988, which is new, and how that works with our local crisis response system and all of the work that the County Commission has been doing, again, for over a decade. So 988 is federal legislation that was passed in 2020. It is part of the National Suicide Hotline Designation Act. It's a federal law that requires new crisis response systems throughout the country. It includes at its core a new 3-digit number, which is 988, and that 988 number is taking the place of the original 800 suicide prevention hotline. So it is taking the system that has always existed and making it more accessible and really taking a step to make it more comprehensive for people. So on July 16th, the number 988 went live. It's going to take quite a bit of time for the entire crisis response system to be fully implemented, because in addition to just a new number, there is an entire model that the legislation supports. And in addition to policy, there's also funding at the federal and state level. And thanks to the County Commission, there's funding at the county level to support this. So nationally and within the state of New Mexico, they've adopted a model called Crisis Now. And I know you all have probably seen this video a couple times. I think I've played it at County Commission meetings numerous times over the last years. But the Crisis Now model, which is the ideal model, is something that everyone is striving for. Different places in the country and in the state have different resources, so it might look different in different communities, but essentially it includes 3 components. One is a call center, which is the 988 call center that includes crisis counselors to answer the phone, available to answer the phone 24/7. So at the very least, that's what exists in communities throughout the country. Similar to 911, you can dial 988 24/7 and reach a crisis counselor. In addition, the full model includes mobile crisis response teams and crisis receiving facilities. Here we call it a crisis triage center. And all of those work together to create the system described in that 988 legislation. So again, what is 988? It is a coordinated effort to respond to crisis. It is to intervene and take the place of 911 when it is a behavioral health emergency. So we have wonderful systems for public safety emergencies. We have wonderful systems for medical emergencies, and now we need just as strong and comparable services for behavioral health emergencies. So again, this new 3-digit number is going to allow people to connect to the right resource at the right time when they're experiencing a behavioral health emergency. The first thing people ask is, when should I call? What is a behavioral health emergency? It's difficult sometimes for us to even think about, when should I take my child to the emergency room? I'm not sure if this warrants a visit to the emergency room or a call to 911. It's even more difficult with 988 just because of the stigma and some of the fear around behavioral health emergencies. So we know that you can call for any reason. You can call if you're having thoughts of suicide. That's probably one of the most critical things and really where the first step in helping improve quality of life and reduce deaths that are happening too early and too often in our community. So thoughts of suicide and any other mental health or substance use crisis, any type of emotional distress. So they are capable of addressing very high acute suicidality and also being there more as a warm line to help people who are having emotional distress, which is good because The earlier in a situation that you can seek help and talk to a trained behavioral health provider, it might stop that emergency or that crisis from progressing. So we do want interventions at the entire width of that spectrum. You can also call 988 if you're worried about someone else. So oftentimes we don't know what to do if we have a friend or a family member who's in crisis. You can call 988 and you can receive resources and helpful information to help connect other people to services. How does it differ from 911? We know that 988, when it is rolled out effectively, and because, again, it connects people to the right person at the right time, it's going to be more effective than 911. Collectively, communities do not believe that a behavioral health emergency is a crime. So we do not need law enforcement to respond. We don't need people to automatically go to jail or any kind of police custody. Thank goodness we've had law enforcement to respond for so many years, but it's time to change that system now. So the goal, again, is to have behavioral health emergencies responded to by people who are behavioral health professionals. It's also, in addition to being more effective for the individual in crisis, it's also more financially feasible. So this system is going to cost less than ambulance trips, hospitalizations, all the hours law enforcement spends. So we know that finances, we have to also be financially responsible. But the other piece of this statement here, I think that's important, is allowing access to care in the least restrictive way. The least restrictive way is usually less expensive, but the least restrictive way is usually less traumatizing for the individual. There's no need to be hospitalized if you can take care of the emergency in your home. It's going to be less traumatizing for the individual in many situations. I failed to mention these slides that don't have the county logo were put together by the state of New Mexico and Cerna Solutions, which is their contracted agency to provide a lot of this work. So I want to thank them for the information that I'm using today. How does 988 differ from 911? Again, 911 focuses on dispatching EMS and law enforcement. 988 focuses on dispatching mental health and addiction services by dispatching trained professionals, whether that means you've talked to someone on the phone, or as you see in that picture there, there's a mobile crisis outreach professional in the community instead of a police officer. There's decades of evidence behind this model to show that it saves money and saves lives. So one of the core research pieces was done by Washington State Institute for Public Policy, and they looked at different models in the country that have been working under this, this type of comprehensive system, and they have quantified how much money has been saved and the changes in people's quality of life. So you can see the RI Recovery Center in Arizona, they've reduced law enforcement calls by 75 to 80% because the majority of those calls now go to mobile crisis teams each year. Other places in Arizona, they looked at how many transfers there were and how many hours in law enforcement time that saved. So how will 988 coordinate with 911? This is something that is really being worked through. It continues to be part of the weekly conversations that are happening at every level. And that is how often people are getting together and talking about this. But ideally, what happens is a person's in crisis. Instead of dialing 911, they dial 988. So the most important thing that we can all do is help spread the word so people know that 988 exists. We have some posters, we have some business cards that will give to you and make available for you to pass out. Anita has some shareable things, digital pieces that you all can share and that the county and the city are sharing through social media and other avenues, because we need to educate the public. So when a crisis happens, they know to dial 988. Once that happens, you'll be connected to a crisis counselor. That crisis counselor, most of the time, will be able to help resolve that situation over the phone. What a change for the individual who, instead of sitting at home all alone, escalating to a situation where you have to go to a hospital or there's a law enforcement interaction, they're able to call somebody, immediately talk, and feel better. The crisis counselors can also receive transfers from 911. So we know that people are going to continue to call 911 because that's the habit. So again, our 911 center and our crisis center, our 988 call center in New Mexico, they are meeting once a week to talk about how do the call takers over at MIRVDA transfer people to 988 when appropriate, so we can put people into that behavioral health system instead of the other system. So the next step, once you dial 988, if the situation cannot be resolved over the phone, in an ideal situation, mobile crisis teams will be dispatched. So we've been working to build the capacity of the mobile crisis teams supported by Doña Ana County, and now they are part of the menu of services that the 988 crisis counselor can offer. So if they can't take care of your needs on the phone, they can dispatch a mobile crisis team. And the state is providing the funding and the resources for those call centers to have the same or similar tools that MIRVDA has. So they will be able to dispatch and track the mobile crisis teams in the community through an online platform that again allows them to monitor where the mobile crisis teams are and communicate with them on scene. If the mobile crisis team isn't able to resolve the issue in the field, which is a parking lot, your home, any kind of community setting, then they have the opportunity to take the individual to a crisis receiving center. Again, in Doña Ana County, we have that, which is the Crisis Triage Center. If you look at the bottom where they are indicating the arrows from 988, there may be times when from 911, there may be times when 911 continues to dispatch law enforcement or EMS because it's difficult to make that determination at the time of the call. But we want to connect those police officers and those EMS also to the crisis receiving center. Then they're really important. The last step is that post-crisis wraparound care. So you heard from the federally qualified health centers that all provide behavioral health. They're part of that post-crisis wraparound care. And lastly, there are still going to be people that need hospital services, but it's a much lower number of people that are going to need hospital services. So again, it's least restrictive, least costly, and it's meeting the individual's needs at the time of their emergency. There are some limitations to this as it rolls out nationally. It's new technology, but I think the challenges are going to be much fewer, and it's going to take much less time than the 911 rollout. That took several decades to get. In the community I grew up, we didn't even have 911 until I was in my 20s. So it takes a while for rural areas in New Mexico and other communities to really take full advantage of these systems. So some of the limitations right now is when you call, you're going to be directed to the state that matches your area code. So if you are living in Doña Ana County and your phone, if you have a cell phone with a Texas area code, the call center in Texas is going to answer your call, not the call center in New Mexico. They are still working on geolocation. The technology exists, but remember the overarching, approach to the hotline, to the suicide prevention hotline, is it's private. You don't have to disclose who you are or where you are. So they're trying to balance making people feel very comfortable and safe calling for help without feeling like that's going to result in you're going to know where I am and you're going to send somebody to my home even if I don't want someone coming to my home. So they don't have the ability to geolocate and answer the call based on where you're calling from. It's based on where your area code is. And they are working out how to balance the privacy issue with the safety issue. They also are able to do text and chat. So that's a new service. Instead of just calling, you can text or chat the 988 number. But again, depending on your area code, you may be texting or chatting with people in a different state. So they're trying to figure out then how those call centers will connect the individual to the resources in their community. And if the individual is willing to say, my name is Jamie and I live in Las Cruces, New Mexico, then it's going to be much easier for them to connect. So what we are telling people, this is the old material for the New Mexico Crisis and Access Line, so I hope you all recognize that logo. People can still call this number. It takes you to the same place. So if I'm working with somebody and I know that they have a 915 area code or something other than a New Mexico area code, I will tell them to continue to use this number because that will connect them to New Mexico call centers. So there are some limitations that people are aware of, and they are figuring out the technology and the ethics behind how to make these most accessible for as many people as possible. But this is the vision for the system. New Mexico had to put their own twist on it, so this came out of the State Behavioral Health Services division, and you can see it looks different because we have hot air balloons and mountains in New Mexico. But it starts with the caller, it moves to the Crisis Now helpline, and then you see how that helpline can connect you to the mobile teams, the crisis centers, the 911 centers, or help schedule an appointment for you directly with the community provider. So there are a lot of different ways that that call center or care traffic control center is going to connect you with services. Here, I think one of the most impactful statements that I always try to remember is what we're doing is we're trying to move from a crisis being a disruption in our care to a crisis being an opportunity for the coordination of care. So in the past, if there was a crisis, you would get law enforcement and or EMS. You might get transported to the hospital. That can be traumatic, and that's more of a disruption in care. The way the diagram works now and the system is laid out, it's an opportunity to connect with that individual, say, we've got people here to help you, and connect them with mobile crisis teams or crisis triage centers, which are much more effective in helping people engage in treatment. So I really like the opportunity for the coordination of care. After the call center, the next leg of this stool is mobile crisis response teams, and the crisis triage center here, or RI International, is operating mobile crisis services co-located at the crisis triage center so they can share staff. You heard Virgil talk about the workforce shortage, so we're really trying to leverage behavioral health providers. So right now, there is one van, and 24/7 there is a two-person team available to respond out to the community. It's a team of a peer and a behavioral health provider, not always independently licensed. So what that team does is they're able to go out into the community, engage with the individual, and bring them back to the triage center for the official clinical assessment. With support from the state of New Mexico, they are funding 4 pilot programs in the state, and Doña Ana County is one of them. So RI International has a contract with the state of New Mexico to go from one van with one team available 24/7 to 4 teams. So they are getting ready to, they are hiring, I think you were there when they were doing interviews yesterday. They are hiring more staff, and they will be acquiring more vehicles so they can have more coverage, because if that one team is out and you get another call, you're going to have to wait. So during peak hours, there'll be at least 2 teams available to respond because they'll have more vehicles and more staff. And by the end of the year, the goal is that those teams will include the licensed clinicians so the assessments can happen on scene, as well as transporting people back to the crisis triage center. So we're well on our way to having a very comprehensive system in Doña Ana County. These are the requirements for the state. They want the mobile crisis response teams to be dispatched and tracked through the 988 system. It has to be a 2-member team, and there are, the regulations describe the qualifications of that 2-member team. And within New Mexico, they're looking at a 90-minute response time, which is a long time when you're in crisis. So we definitely want to be under those 90 minutes. But if you're driving to Chaparral or to other rural areas, it's going to take a while. They will provide the intervention, the screening, the assessments, and referrals, and they will coordinate with law enforcement and first responders when necessary. There, again, is decades worth of data that shows when mobile crisis teams need to call law enforcement and EMS. It is a very small % of the time, but it is very critical cases when they do. So there still needs to be cooperation between mobile crisis, law enforcement, and EMS. Crisis triage centers are the third piece. Again, you all are very familiar because we have the crisis triage center here. We're licensed as the 23-hour. Different places in New Mexico are going to have different opportunities for different types of crisis centers because most communities are not going to have standalone crisis facilities like we do here. So the last piece of information I wanted to share with you, we've had the Crisis Triage Center open for just over a year now, which is definitely something to celebrate. Here's some data from the first year of operation. So these are the number of guests each month, number of admissions each month, and you can see that we have a nice steady increase, which is important because at the beginning we were looking at some very low numbers and we were not using the full capacity of the facility. We're still not close to using the full capacity of the facility. These numbers could double or triple and they can still provide, there's still enough capacity there to provide care. But it's important for us to see that the word is getting out and more people are using the crisis triage center. So as of July, there were 827 admissions over the year. Here are the referral sources. So how are people getting to the crisis triage center? The majority of the people are coming in on their own or with family or friends. So that self-referral is the largest piece of the pie there. Next, we have law enforcement and homeless services. Homeless services is primarily Community of Hope and those associated agencies. We also have the outpatient services, so clinical providers in the community are referring people when they're in crisis because they may not be able to get in to see their provider today, but those providers know that their patients can go to the crisis triage center and have a safe place and a qualified professional intervene. We also have the detention center and the emergency department making referrals into the crisis triage center. So this is June's data and this is July's data. It looks very similar. If you looked at this in other communities, it would look much different because in other communities, law enforcement is about 85% of the referrals into the facilities. So yeah, we're very different in Doña Ana County. It's a different set of circumstances that was unexpected. But again, we're seeing that self-referral, the emergency department numbers are growing. So we are receiving referrals from multiple locations, but we have capacity to receive more. When people leave the facility, they're discharged to different locations, primarily outpatient and inpatient services. Some return to their family who have connected them to their established providers. About 5% during the nurses' check at the crisis triage center, about 5% need to go to a hospital for other medical reasons. And then there's a good percent of people that decline the referrals. A lot of these folks come back again and eventually accept a referral. But the point of the crisis triage center is to keep you safe at that time, and they've done that. And they do work hard to connect people to resources, but their acceptance of the referral is still voluntary. Here's July. Again, most people in July were connected to outpatient services. We still had a pretty good chunk that declined the referral and a very small percent that went on to a higher level of medical care. The mobile services that are being provided started just less than a year ago with some county funding. They're going to be expanding with the funding from the state. Right now they have one van, 24/7, two-person team available. It will become 4 teams available. It's not going to be 4 all at the same time because they have to cover 24/7 shifts, and it will include licensed clinicians. So they're going to go from just basic mobile services to a fully certified and licensed mobile crisis response team. It will be dispatched and tracked through the 988 system, and eventually it will be reimbursed by Medicaid. So the pilot project with the state is to look at how they operate. RI staff are helping give feedback on the regulations and the rules about licensing and about billing. So in 2024, the plan is that Medicaid will reimburse for the mobile crisis services, which will reduce government funding to support those services. Since it began, there were, the first year, there were 101 mobile responses. This year so far, there's been 378 for a total of 479 mobile services operated by RI out of the Crisis Triage Center. So that is the information I have for you on 988 and what it looks like in New Mexico. On Friday, August 26th at 10:30, we're going to have a 988 kickoff event. You all should be receiving an invitation if you haven't. I think some of them went out on Friday. We're working with the local collaborative with LC3 to host it here on the North Lawn. I know it's going to be warm, but we're trying to balance the COVID-safe practices with having a large number of people in one place. We're inviting to speak. We have the director for the state's Behavioral Health Services Division is going to be here. Dr. Bowen will speak. We're going to have a representative from the call center, from the mobile crisis, and the triage center, so people can visually see what our crisis response system looks like. And then other behavioral health providers are going to be invited to set up tables. It'll be an opportunity to see the system and to learn more about it. So you're all invited to that. And again, please pick up some of these cards and start helping us spread the word on 988. Thank you.
Thank you, Ms. Michael. Are there any questions? Commissioner Chaparro?
Mr. Chair, Jamie, first of all, congratulations on this presentation. I know you've been working very, very hard on this, and it gives my heart much joy due to the background that several of us have here. And I really appreciate when you use the word team, because it is a team effort. It's a team effort throughout the community, not only with the county partnering with behavioral health specialists, but also with law enforcement. But can we go back to the slide on the referral sources, please? Thank you. And specifically, I'm looking at the law enforcement, 15% referrals. Which agency of law enforcement is working with this, with the 988? Which agency of the law enforcement is more involved?
The data indicates the Las Cruces Police Department. I don't have the numbers on the top of my head, but the Las Cruces Police Department is responsible for the overwhelming majority of those. We've had one or two from Mesilla Marshals, from NMSU Police Department, and 2 weeks ago we had our first referral and admission from the Sheriff's Department. But the overwhelming majority are Las Cruces Police Department. In addition to using the triage center, the team that is working on the full crisis response system, the city and the county, it's been almost 2 years now, created a work group, a Crisis Now work group, and we've had great participation from the City of Las Cruces Police Department on that team, meeting every month to discuss what is it going to look like in our community. So we've been working closely with our partners to not just look at the referrals into the center, but look at the full system.
Thank you for that response. And so my thanks go out to the Las Cruces Police Department for working with this team.
We need to all thank Sergeant McCord with the Las Cruces Police Department, and he is going to be retiring this year. So encourage the police department to help fill that void that he is going to leave.
Thank you again, Jamie.
Thank you, Commissioner Chaparro. Are there any other questions for Ms. Michael?
Mr. Chair, if I may.
Madam Vice Chair?
I wanted to echo Commissioner Chaparro's sentiments on congratulating this team. I do have two questions. The first one, I don't know who it can be directed to, but the 988 call, will it be the same cost as a 911 call? You know how who would it?
I'm sorry, Commissioner, did you say the same cost?
Yes, you know how the 911 call, you know, I can't remember the amount, but for each call, will be similar with the 988 call?
So right now, the state general fund is paying the entire cost of the 988 call centers, the expansion from the call center to include text and chat. The state general fund is covering that, but the federal legislation gave states the ability to enact different surcharges and fees if needed. So New Mexico is looking at, in the future, should our state enact some additional fees and charges that would then mirror 911, and everybody would contribute to the funding that supports that service. So right now, general fund with the state of New Mexico, but it could change in the future.
Okay. And then second question, what is an average of the calls we have here, mobile services, total 479, right? So calls, what is average? 10 calls a day, 20? What is an average?
For the mobile services, I don't have the average per day for mobile services. I just have the number of total calls.
Or how many calls do you usually get on the 988? Do you have any data with that? I was just wondering.
I just received an email that has the calls that come to the 988 center from Doñana County. So I will share that with you all via email through our county manager. I did just receive that information. So I will share that with you.
Okay. And then so when it has a mobile service, and usually if it's take them to the triage center, in case it gets worse, right? The patient is not, it's something more drastic. Do you switch to an ambulance to take them to the hospital?
So the 988 and in our community, the 911 call takers are all looking at what indicators they need to assess to determine, is this a mobile crisis team dispatch or is this a 911 medical dispatch? So they will have a set of criteria. So if I'm feeling like I'm going to hurt myself, if I've expressed suicidal ideations, thoughts, and behaviors, it's most likely that I'm going to get a mobile crisis team response. If I have already injured myself, if I have cut myself, if I have ingested some kind of substance, I will get a 911 EMS response. But that's when 988 and 911 work together to be able to determine. And in other communities, there are times when in doubt, they will send out EMS and law enforcement, and when they get there, they say, nope, we need mobile crisis. So then mobile crisis will join them on scene, or vice versa. Mobile crisis goes out and they see, like you said, it's escalated, and mobile crisis will be able to call directly and get a law enforcement or an EMS response if needed.
Thank you.
Thank you.
Thank you, Vice Chair Murillo.
Mr. Chairman,
Commissioner Alens?
how many mobile crisis teams are there in the county right now?
In Doñana County,
Yes.
there is one available 24/7
And how is it funded?
through Doñana County government right now. Through the ARPA funding it's operated as part of the Crisis Triage Center and under that contract that we have with RI.
Now, did you say that they're contemplating adding more mobile crisis teams at the triage center?
Yes, the plan is to go from 1 team to 4 teams and probably 2 or 3 vehicles. And the state of New Mexico is piloting that, so they are going to fund that expansion.
Do those vehicles need special equipment?
They are vans and minivans, and they do have some special equipment to create a safe place for the guests in the back.
Do we know how many crisis calls are currently going into 911?
Hugo knows how many crisis calls are going to 911. I don't have that data with me right now, but I know there are several behavioral health calls each day that the 911 center answers. I don't have an exact number for you on the number right now, but I can also get that data to you all.
When the 911 operator identifies the call as being of a crisis nature, is the call immediately transferred to 988?
Commissioner Ellens, they are working on that. Hugo and his team, again, meet each week with the team from the New Mexico crisis line, and Hugo has set up the protocols for the decision tree for their call takers, and they've done a lot of cross-training. So it is being implemented, and it is slowly starting to happen.
Because it seems to me that most of the calls for the foreseeable future will go into 911, because I doubt if the crisis population is aware of the 988 availability.
I agree. So we're still going to have most people dial 911, so the intervention needs to happen at that point. The call taker at our 911 center needs to go through their decision tree and divert the call to 988 at that point. And we've been working with Hugo, and he's been working with his call takers to ramp up that process. So as members of the MRVDA board, county government can help influence that and help support that, because we do want to look at the number of calls that are transferred to 988. That's the only way the system is going to be effective.
What was the number of mobile crisis unit calls? You had that in one of the charts.
The mobile crisis that have operated out of the Crisis Triage Center for our community, the total number since September of last year is 479. And that has not been through the 988 or the 911 system. That's been individuals or agencies calling the triage center directly and saying, I need help, can you come to me?
So that's one unit that has made 479 trips.
Correct.
And that's 24/7.
Yes, sir.
Which means there are at least 2 teams.
Because it's 24/7, there are several staff that are part of that service line. But again, co-locating it with the triage center means they can hire 5 peers, and those 5 peers may be covering the mobile services that day or may stay on site to provide care at the triage center. So that's really one of the benefits of co-locating it there.
And the expectation is that the triage center will have 4 mobile crisis vehicles.
The expectation is there will be enough staff and equipment for 4 teams, and the plan for when each of those teams is going to work hasn't been decided yet. So there'll be 24/7 coverage, and there may be 2 teams that work during the peak hours, but during the non-peak hours, it might just be 1 team working at a time. So there'll still be 24/7 coverage, but I don't know how many teams will work at the same time. We're still waiting on the data to indicate the need for that.
Okay, thank you.
Thank you, Commissioner Allens. Commissioner Reynolds?
Thank you, Mr. Chair. Thank you, Ms. Michael. I'd like to actually echo, as the current chair of the MRVDA board, I'd like to echo what she said about the 988 911 service. We've only had this in place for a month, and there are some growing pains and there are some challenges. And one of them she's pointed out that's very challenging is how do we identify the location of a person through 988? the infrastructure doesn't support the capability for us to do that. And this is actually a problem that's at the national level with the technology that's used in order to call in. So when you call in with a phone, and try to identify and backtrace where the person's at, the technology is just not there yet and clean for it to be done. So we're still working. As a matter of fact, we're working together between MRVDA and 988 and Jamie Michael and RI to try to figure out exactly how this whole process is going to work. This is an early version of it. Please don't get discouraged. There's a lot more to be done, and I would say that we'll have this presentation again probably in October, and this will all be, ironed out and working perfectly, well, as perfectly as it can. Thank you. Thank you, Ms. Michael.
Thank you, Commissioner Reynolds. Ms. Michael, you had mentioned, obviously, we're talking with MRVDA here, and you'd mentioned there was a decision tree. Is that part of their standard operating procedure, or how is that being communicated?
Hugo has sent it to me as part of their standard operating procedure and what their call takers, how their call takers are trained and what steps they're supposed to take when they receive a behavioral health call.
How does MRVDA know, I guess, once the care team, I can't remember if that's specifically what it was called by the Las Cruces Fire Department, how will they, or I guess it's really the state call center know how to dispatch the Crisis Triage Center or Las Cruces Fire Department?
So Las Cruces Fire Department is also looking at standing up mobile services because they will be co-located with an EMS service agency, not a behavioral health service agency. They will not be funded by the state, reimbursed by Medicaid, or dispatched through 988. So the team that the city is standing up through their fire department will not be part of the 988 system.
Okay, that seems like counterintuitive, because if that's their goal, and I guess you're not the person now, that would be for the city, but it just seems like that would be part of the process, which leads me to the next question, which I know you had mentioned Sergeant McCord getting ready to retire. And this, I think, leads to what we do with DASO. Would it not make a lot of, I guess, where we need to stand up and having standard operating procedures both for DASO and for LCPD to know when to bring, people, residents into the crisis triage center or to call for mental health services? Because I know, none of that exists now. But how do we make sure that they know where to be able to bring people for the services they need rather than incarcerating them? And it may not necessarily be, I know you had mentioned, I think the question came up of, where do they go at what point? You had mentioned that if somebody had suicidal ideations or was already in the process, do they go to Memorial Medical Center? Do they go to the triage center? I guess those are questions that I feel like where our law enforcement, because I know that was one of the things that was brought up originally, is we want to reduce the amount of incarceration for those that are experiencing a mental or a behavioral health crisis. And so I guess where I'm going with this is I'm asking that we create procedures with not just DASO, but Las Cruces Police Department, so that those are set up and it's clear. And then it's up to the organizations and the leadership to make sure those go down. And that way we have, or they know when and where to dispatch, when to call, where to bring them to. I think that's one of the things that we're missing with this next step of as we grow the Crisis Triage Center and behavioral health here in Doña Ana County, is making sure that law enforcement is an integral part of that. And not relying on just one person like Sergeant McCord.
Correct.
It should be something that's within their operating procedures.
Commissioner Sanchez, I want to address a couple things. I know there's been challenges with the relationship between the Crisis Triage Center and DASO, but I'm very optimistic. Last week, they did use the Triage Center, and it was a very successful referral, very successful warm handoff. And their mental health consultant that they've hired has been attending the Crisis Now meetings, part of the CTC stakeholder meetings, so really becoming part of those conversations. You're absolutely correct. We need, as a community, to have collective SOPs or a collective approach to how to use this system. The best way to do it that we've seen work in other communities is through CIT programs. So CIT can be CIT training, can be CIT team, but we need to look at it more globally as CIT programs. And when it works best, the behavioral health community is part of the CIT program within the law enforcement agency. So if they're teaching 40 hours of CIT training, X number of those hours are taught by the clinical director at the Crisis Triage Center, by the director of the mobile crisis team, by all of the behavioral health providers. There has to be, we're asking law enforcement to really shift and move away from the way they've been doing business for so many years. And in order to do that, we need to meet them and share across those two fields the expertise. Law enforcement needs to understand what a behavioral health provider is doing so they feel confident that they will be safe in these situations and respond appropriately. And on scene, they need to be able to work together. And where I've seen it work beautifully, it's almost like a dance on scene. Law enforcement knows that at this moment it's a public safety issue, so they take the lead. But it could change, and the next moment it could become a behavioral health issue. They step back, and the behavioral health person takes the lead. That's not going to happen unless there are strong, trusting relationships and they're part of each other's training.
I appreciate it, and I think that's a perfect segue because I believe this commission just approved a training or a contract for the Sheriff's Department that included CIT. And I think that's exactly why I would love to see how that is being integrated with what we do with standard operating procedures so that it becomes part of their processes. You know, no matter, again, who's in the leadership, it is there as part of their processes.
Absolutely.
Thank you.
Thank you.
Are there any other comments, questions? Commissioner Jones?
Do you have any idea as a percentage of those who are admitted to the center are agreeing to stay beyond the 23-hour limit?
So I do know that the average length of stay is about 6 hours. So it takes, on average, 6 hours to do the medical check with the nurse and the conversations and engagement with the peers and the clinicians to help stabilize the individual and then connect them to services. Some people do stay closer to the 23 hours, but they have to be out of the facility within the 23 hours because of the licensing. So at that point, if they're not well enough, then they go to a hospital. They go to an inpatient hospital. And it depends. I have the month of July, and it looks like 12% went to an inpatient hospital. But in the month of June, it was 30%. So we do know that people need a higher level of care in a lot of circumstances. The Triage Center is exploring expanding from a 23-hour to the 14-day license, which would allow people to maybe stay there a couple more days and reduce that number of inpatient hospitalizations in those circumstances.
Well, it was my recollection that a person could stay beyond the 23 hours if they consented to it.
The facility is just licensed for 23-hour stays, so people do not stay there beyond that. It turns into a residential facility, so there has to be, the individual sleeping and room accommodations, different food and kitchen accommodations once you go from basically an outpatient to a residential type of facility.
Is there a plan to do that?
They're creating the plan to look at what investment we would need in the facility and in the staff, what the impact on the operation would be if we go to the 14-day. But RI has submitted a letter to the New Mexico Department of Health, a letter of intent, saying we intend on applying for the 14-day license, and they are looking at, do we make it a dual license? So some people are in the facility as the 23-hour, and that's how you bill, or is it all going to be a 14-day license? And just because it's 14-day, you can still leave in 2 or 3 hours. So they've submitted the letter of intent to the Department of Health, but there's still a lot of planning to be done before the county makes that determination. So it would be up to the Board of County Commissioners to make that determination.
Thank you.
Thank you.
Thank you, Commissioner Ellens. Are there any other comments? All right. Thank you, Ms. Michael.
Thank you. And again, Mr. Macias has the business cards, Spanish and English. We will have magnets and posters and other information for you all to help us spread the word. Thank you.
Okay.
Mr. Chair,
Commissioner Reynolds?
before we go on, I'd like to recognize that Senator Steinborn has joined us. Thank you.
Welcome, Senator Steinborn. All right, let's see, we're on to consent agenda items. It's agenda items 4 through 10. Are there any consent agenda items that commissioners would like to pull for separate consideration?
Mr. Chairman,
Commissioner Ellens?
I would have a question on item 10.
Okay. What is that question? I know, looks like we've got Ms. Bachman coming up and joining us. So what's the question, Commissioner Ellens?
Well, have we moved the consent agenda yet?
Well, I was going to do it after you asked your question, if that's
All
okay.
right. What's the nature of the position that's being sent to Denver for this conference?
Thank you for the question, Chair, Commissioners. We're excited to be able to send Janice Huron, who is the Bureau of Election Supervisor, to the Election Center Conference. It's a conference that includes election officials from across the country. Many are there pursuing a certified election professional certification that's recognized nationally. And Janice, Ms. Huron, will be continuing her education in that certification.
Good, you're sending the right person. Thank you.
Thank you, Commissioner Ellens.
Are there any other questions for Ms. Bachman? All right. If there are no other questions on consent agenda, if I can get a motion to approve agenda items 4 through 10?
So moved.
All right, motion by Commissioner Chaparro. Commissioner Ellens, if you don't mind me using that year as a second?
Yes.
Thank you. Okay, so the motion and the second on agenda items 4 through 10. If I can get roll call, Brandy.
Commissioner Ellens?
Yes.
Commissioner Reynolds?
Yes.
Commissioner Chaparro?
Yes.
Vice Chair Murillo?
Yes.
Chair Sanchez?
Yes. Okay. All right, we're on agenda item number 11, which is to approve a final plat for the Sanctuary Phase 2A subdivision. Ms. Christine Ainsworth.
Thank you, Mr. Chair. There is a presentation,
Okay.
but I'll go ahead.
And before we start, I mean, is this considered, are we doing this as a hearing, or is this just the,
It is a hearing.
okay. If that's the case, then I'll ask you to raise your right hand. Do you swear and affirm the testimony you're about to give is the truth under penalty of law?
I do.
Thank you. Please proceed.
Okay. This is a request for a final plat. This property is a part of a larger master plan, sketch plan that was approved in the ETZ originally for 78.31 acres. It was approved in 2005. Phase 1 has already been completed, and this Phase 2A is a portion of that site that you will see in your packet off of Carver Road and San Pablo Road. The final plat that's under consideration right now is 17 lots, ranging in size from 0.33 to 0.57 acres. It's complete with the exception of the electrical infrastructure. The applicant will be submitting a financial guarantee for that infrastructure that is still needed. However, everything else is already in the utilities. That cul-de-sac has been already completed as well. And so they are requesting approval for that final plat. I apologize that the presentation is not up. I'm not sure what happened.
Okay, I know, looks like it's starting to come up here.
You don't have it? I'm going to send them a message, but hopefully you were able to see from the packet.
Yes, so I know we're waiting for the presentation. Are there any questions from the commission for Ms. Ainsworth while we're waiting? Mr. Reynolds?
Yes, thank you, Mr. Chair. Ms. Ainsworth,
Yes.
I assume the electrical package has to do with the lighting that's required now?
Right, the infrastructure for, basically for everything, not just the street light. I don't know if this one has street lights actually, but the electricity going to the homes has,
Okay.
that infrastructure is not there yet.
Okay, did it used to be, did the, when the ETC approved this, was the electric above ground or was it underground?
I do not have that information. Perhaps the applicant can share that.
So, because I
There's a
know now,
representative here.
I see in reviewing this, that it actually says the underground utilities for the electric are supposed to be part of the subdivision as our new requirements are. And I'm asking, are they also going to be required to put up streetlights?
Right.
Is that part of it? Okay.
This is from an old, like I said, this is from the ETZ. And so I think those questions are better answered by the applicant.
Okay. And then the last one I'd like to ask them probably is sidewalks. Yeah, thank you.
Right. Okay, thank you.
Okay. I guess while we're, I don't know if we're still waiting, I'll allow if the applicant, Mr. Rogers, is here. If you can raise your right hand. Do you swear and affirm the testimony you're about to give is the truth under penalty of law?
I do.
All right, state your name for the record.
My name is Ted Scanlon. My address is 2990 North Main Street, Suite 3C.
Very good. I know, like I said, I know we're still waiting for the presentation to be loaded for everyone else to see, but I know we have the application in our packet. So I don't know if there's any comments you'd like to add or any, I know Commissioner Reynolds had the one question regarding lights and electrical. I don't know if you can answer any of those questions.
Sure, El Paso Electric's backed up right now. As you know, there's a lot of development going on in the county at this time, and so they're kind of behind. But in order to be able to file the plat, my client has agreed to put up a letter of credit with El Paso Electric in order to ensure the completion of the electric system within the subdivision, and so that's the situation with that. The subdivision is designed to look exactly like the original Phase 1 subdivision, which is one of the subdivisions that I've designed that I'm most proud of in this county. It's really a nice place. And they have their city sewer, all of the utilities are underground, and it's a nice place.
Mm-hmm. Thank you. Commissioner Reynolds, did you have any other questions?
Thank you, Mr. Chair. Yeah, Mr. Scanlon. So do you currently have streetlights in the original development?
It's been 17 years, I think, since I did Phase 1, and I'm trying to decide because I know that there was some discussion back in the day that they wanted to try to keep it darker out there, but I don't recall. I think we have some decorative type street lights around the subdivision, and of course there's sidewalks throughout. And
Yeah, that's all I needed. Everything else looks really good from what I can see from the plat. Thank you.
Are there any other questions for the applicant? Okay.
thank you.
Christina, I don't know if there's anything else we need to, I don't know if you want to still run through quickly or.
Just to show you where it's located, there off of Carver and San Pablo Road. Over here is Phase 1, which was completed. Phase 2 encompasses this parcel as well as this one. And the Phase 2A is right here in the corner. And just so you can see the photos of the area. This is looking on San Pascual Street. And this is the actual subdivision, which is the subject of the final plat today. This is the road that has already been completed. You can see there's already infrastructure in there, with the exception of the electrical infrastructure.
Okay. Thank you. Any questions now that we have it up from the commission? All right, not seeing any. All right, are there anybody here for public comment on the plat approval? All right. Yes, ma'am, please go ahead and come up. If you can raise your right hand. Do you swear to affirm the testimony you're about to give is the truth under penalty of law?
I do.
Thank you. Please state your name for the record.
Hi, my name is Debbie Campbell, and I'm a resident in the sanctuary, actually the president of the HOA there. And no one has any objection to this, but if you look at the whole subdivision, this whole second phase, there's only one entrance and one exit. And as homeowners, we're very concerned about the traffic coming in and out through just that one exit. And our question or comment is, can there be an entrance and exit off of San Pablo as well? Because you're going to have the whole subdivision coming through 2 entrances and only one entrance and exit to phase 2.
Okay. Thank you. I appreciate it. I don't know if I know that's something we can't specifically answer. Ms. Ainsworth, is there any requirements for more than one exit?
Well, as I mentioned, this was approved many years ago in the ETZ, and so that layout was already approved, but I can kind of see in the grading, and the applicant can confirm, but it appears that only one was approved, although there may be some access on off of Santa Cruz Road, from what I can tell, at a later phase. And it would comply with our requirements. A second access would be needed over a certain number of lots, and assuming they had the same standards in 2005, then it was reviewed and approved according to those standards.
If the applicant, if they were to so design it so that there is a second, if we were to approve it today and they modified it so that or try to make a request to put in another exit, would that be something that would have to come back to the commission for?
They would come in with a final plat at that point that would show another access point when they are at a phase where they could make a connection like that. In this particular one, because it's a cul-de-sac and it's already constructed, obviously they wouldn't be able to put one in now.
Okay.
Mr. Chair.
Commissioner Chaparro?
Christine, I have a question for you. Is this a concern for emergency services possibly going in there? Maybe ambulance, maybe the sheriff's department, maybe, I don't know, I'm just, and the applicant is shaking her head. Is that the concern, perhaps? Right, and like I said, because it was reviewed previously by a different arrangement of approving bodies, those standards that were in place at the time were used to review it. However, those requirements for emergency services really have not changed. This cul-de-sac was designed so that it has the proper turnaround for emergency vehicles, and the entire master plan as a whole was reviewed for compliance for emergency services as well. And just another comment, I know that some areas are designed that way so that residents are safer, such as in gated communities, so that there's not a lot of traffic coming in and out. But thank you.
Thank you, Commissioner Chaparro. And I'm looking at here at the map, and I think when I'm looking at this phase 2A, it looks like that doesn't fully take in the whole lot. There's still possible, I see future phase 2B is in Bravo, and then future phase 2D is in Delta on the east side. And so that might be an opportunity to extend any entrance to San Pablo, if that's what the request is. And I would encourage the HOA to maybe hopefully provide that feedback to the developers that as they continue that development, to maybe extend that out and be part of a future development. I'm sorry, if you wouldn't mind, sorry. You'll have to come up to the microphone, I apologize, just for the record, so we can. No worries. If you can raise your right hand. Do you swear and affirm the testimony you're about to give is the truth under penalty of law?
I do.
Thank you. State your name for the record, please.
My name is Robert Duran. I live there at the sanctuary also.
Thank you.
This is the first, there's 3 more phases that are going to come into that area. And right now we see a lot of traffic on Carver with the schools down the road. There's an immense amount of traffic. You know, with the other three phases coming in is going to create quite a bit of traffic on Carver, so with just one entrance and exit. So it creates a lot of hazards for the residents there at the sanctuary. And that is our concern.
Yeah, understand. And I appreciate you raising the concern, sir. I think what I've seen in the past is that, and it's not, that's why I say when I look at where Sanctuary Avenue is, I believe when you have people that are coming through on, this is further south, but on Santa Cruz, I mean, it's all dirt. They come up over and off of San Pablo and kind of go through the lot to get to the rest of Santa Cruz rather than coming on Highway 28 is what I've seen in the past. I don't know if it's still that way, but like I said, I do know that some people come on San Pablo. And so, like I said, I think based off of what I'm seeing here with 2A, you know, I think when they're looking at some of the other phases, perhaps, like I said, if there's other ways in which to mitigate those or creating additional entrance spots, that might be something that the
correct, because with this phase, you know, there's 17, you know, plots. You know, with 3 other phases, you know, it's going to be about approximately 80 more homes in there. So it's going to create a havoc there in that area.
Yeah.
You know, not only for, you know, law enforcement and emergency services, but
for the residents.
Residents there entering and leaving, you know, each day.
Yes, sir. Understand. So thank you so much. Are there any questions for the resident?
Mr. Chairman?
Commissioner Allens?
Christina, can you bring up the plat, please? Now, okay. Is there any way at this point in time to modify that to create a separate exit?
This subdivision has already been completed. So the street has already been paved, and it would not be possible to modify this particular phase. It would, in later phases, there may be a possibility to add another entry. However, this one is already complete.
So we're kind of stuck.
Yes.
Thank you.
Okay. Are there any other questions? Okay. Did you also, yeah, absolutely, sir.
Just a couple of points of clarification. This entire area was master planned back in 2004 and 2005. At that time, a very comprehensive traffic impact analysis was presented to the county and the state because we have access on both Highway 28 and Carver Road. Sanctuary Avenue goes to Highway 28 and San Pascual, I think it is the name of the street that connects to Carver Road. In addition to that, we did an updated traffic impact analysis just a couple of years ago, which was reviewed and approved by both the county and the state, that indicated the need for some additional pavement and so forth on Highway 28 and on Carver Road, which those improvements have been completed with this first phase of phase 2. And if you go out there and look, it's pretty good improvement to both Carver Road and Highway 28. So, and both of those TIAs were approved by both the state and the county. So,
thank you.
The TIA is a traffic impact analysis. Okay. Sorry.
Absolutely. Thank you for the clarification. Okay, is there any other input from the commission? All right, if I can get a motion and a second to approve agenda item number 11, which is the final plat for Sanctuary Phase 2A.
So moved.
Moved by Commissioner Ellens.
Second.
Seconded by Commissioner Chaparro. Okay.
Thank you.
Randy, will you call the roll, please?
Commissioner Ellens?
Yes.
Commissioner Reynolds?
Yes.
Commissioner Chaparro?
Yes.
Vice Chair Murillo?
Yes.
Chair Sanchez?
Yes. Okay. All right. All right, on agenda item number 12, Brandy, is there any correspondence?
Yes. Kate Furlick as the personal representative of the wrongful death estate of Isaac Breeley Rood versus Doñana County. Edward Walters versus Doñana County. Mario Rodriguez versus Doñana County. And Jesus Garcia versus Doñana County.
Thank you, Brandy. Okay, we're on to the public input portion of our meeting. I appreciate for those of you that are still here, thank you so much for being patient, allowing us to get through our business today. I'll invite, I know Senator Steinborn, did you have any public comment? I'll invite you up first if you'd like, and then the others.
Thank you, Mr. Chair. I may or may not have another public comment, just depending upon other events that occur here this morning, because I know there's been a lot of concerns with the election, and so I may have an interest in speaking on that. But while I am here, I thought I'd take the opportunity to thank you, Doñana County Commission, and thank the staff very much for all your support of Film Las Cruces and the recent increase in funding. I would mention names, but I would forget somebody. But safe to say there's been so many great people here in the county who's been so helpful to film economic development here and helping to support these film productions when they come in. We really appreciate it. We have some really exciting things in the works. And unfortunately, in the film business, you always got to be a little tight-lipped and coy, but I will tell you there's some really exciting things happening, some announcements that may be coming soon. And, the funding from the county has helped us get a new office, has helped us hire new staff, has helped us, we're going to be redoing and kind of going with a 2.0 website. So you really have helped us take our game to the next level, which is going to help us do an even better job recruiting films here. So just want to thank you all very much for your support. And the success that's happening is your success. It's a team effort. So thank you, Mr. Chairman.
Thank you so much, Senator Steinborn. I appreciate you coming.
And I also want to acknowledge the town of Anthony while I have the commissioner here. They just also joined Doñana County and the City of Las Cruces as a core partner of Film Las Cruces funding as we continue to regionalize. So we look forward to shining a brighter light on Anthony as well for film. Yes, thank you very much, Mayor, Commissioner.
Thank you so much. All right, I'd welcome anybody else up for public comment. Oh, you don't need, we're not in a hearing. This is just public input, so I appreciate you coming up, so.
Well, thanks. This is my first commission meeting. We're new residents. We moved here in 2020, and we were in between because we had a summer home in Wisconsin and a permanent home in California, and I really wanted to vote in 2020. And I couldn't get a driver's license here, and I couldn't get vote here because I was living in Wisconsin part of the time. So I called the clerk's office and I got terrific help. And we worked it all out with my California license, and I got an absentee ballot, and I was able to vote in the 2020 election. So I really appreciated it. And I came today because I wanted to be sure that if anybody was unhappy with the elections office, I had a really good experience. And I also wanted to mention that in general, I'm really concerned about our democracy and about our clerks who are wonderful people. My sister is 79 years old, and she's a poll worker. My wife is 79, also has worked as a poll worker. And I've never known a poll worker who wasn't very committed to caring about democracy and very conscious of the importance of being accurate, fair, and neutral in terms of helping people vote. So I wanted to say that. And then I had one other issue. I didn't come up to talk about Phase 2, but I live off of Carver Road, right by Phase 2. And everything that was said here was completely accurate. And Mr. Chairman, you're right. It makes all kinds of sense to put that other entrance off of San Pablo when they do the other development. And I'm sure that the county Public Works Department realizes they're going to have to do something with Carver Road because it's getting awfully busy.
It is. We've had a lot of
busier. Thank you very much.
Absolutely. Thank you so much. Welcome to Doñana County. If you wouldn't mind signing our book here on the left side, sir.
Excuse me, sir. Yeah.
If you wouldn't mind signing our book so we have you for the record as well. And thank you so much.
And Mr. Chair, I think he also forgot to, he didn't say his name when he came up, I don't believe.
Oh, I apologize. Yes. If you, thank you for pointing that out. And sir, and if you wouldn't mind coming back up and stating your name for the record as well, I apologize that I forgot to ask you for state your name for the record.
I meant to say it right at the beginning. The name is Jerry Scribner.
Very good. Thank you,
My
Mr.
wife's
Scribner.
name is Penny.
Come on up, please. Good morning, and thank you for your patience. If you wouldn't mind stating your name for the record, please.
I'm Johnny Ruth Aldrich. I am a concerned citizen of Doñana County and a member of the League of Women Voters. I would like to support the previous testimony about the efficiency and helpfulness of the Doñana County Elections Bureau. I'm aware that there have been some negative criticisms lately about the conduct of the election process, and I'm here to compliment the state and Doñana County's Bureau of Elections on the validity and worthiness and accuracy of the recent primary election and every other one that's happened. I'd like to share part of an email that came from Maggie Toulouse Oliver, the Secretary of State of New Mexico. Apparently, after the primary elections, there were 6 races that were incredibly close. New Mexico State mandates that in that case, a recount must be done of those counts. There were no errors. Fortunately, the state of New Mexico still has paper ballots. There was not a single change in all of those 6 races. Our elections are well done, accurate, because our machines are kept in order, checked, and this is statewide, which includes Doñana County. I'd like to close by saying thank you to the commission for making time for public comment. A republic can't work without leaders listening to citizens. Thank you very much.
Thank you so much. If you would be kind as to sign the book there on the left. Thank you. Are there any other public comments?
Yeah, my name is Jim Hurst, Hoerst. And I'd like to comment on the practice of having the public comments at the end of the meeting. It's unconstitutional. It constitutes cruel and unusual punishment to have to wait for the whole meeting to make a 2-minute comment. it seems as though the county commission does not want public comments. And that's understandable, given the constituency that has made the comments lately, and they seem to be fairly redundant, but nonetheless, you're going to be here that much time anyway. If you allow public comments and they come in, you're going to be here for that amount of time. If it's 20 comments, it's 40 minutes, but it's going to be at the beginning or the end of the meeting, unless, of course, people are discouraged from commenting because they don't want to wait through the whole meeting. And so I ask you to rethink that policy, presuming you want public comment. Thank you very much.
Thank you, Mr. Horace, appreciate it. Is there any other public input to this time? Okay. All right, then I think we're on to our agenda. Do we plan on convening in closed session for an updates?
No, sir.
Oh, okay, well, if there's no closed session, then we've reached the end of our agenda. So at 11:19 a.m., we'll call this meeting adjourned. Thank you all so much for coming, and appreciate your participation.